sorry, I'm like all over your book.
Oh, I don't care.
Is that the same one as the whiteboard?
Yes,
Come on,
it's
Max.
exactly the
Sorry.
same as the whiteboard, guys.
Just
This
balance on
opening,
these. Fine.
this opening here is called the external nares, right? External nair, which leads to this vestibule. The vestibule opens up into the entire nasal cavity, and then you have the concha, superior, middle, and inferior, and meatuses, which are the depressions between them, superior, middle, and inferior. At the back of the concha is a airway called the internal nares. External, internal nares, with the opening to the eustachian tubes right here. The back of the throat is called the pharynx. 3 parts come all the way to the back from the opening of the nose to the nasopharynx. From the opening of the mouth to the back of the mouth is the oropharynx, and to the larynx is the hypopharynx. Nasopharynx, oropharynx, hypopharynx, also known as the laryngopharynx. And then we have the pharyngeal tonsils. You have the palatine tonsils, and you have the lingual tonsils. This is the hard palate, and this is the soft palate. This is the uvula. Here's the epiglottis. This is the true vocal cord right here. The one up top is the false vocal cord. And of course the opening is called the rama glottis that air passes through. Over here, continuing on from the larynx, we get to the trachea. You can see the C cartilages and the little blue last cartilage here called the carina. And it splits into the left primary bronchus. I'm sorry, what is that? Right here. Left primary bronchus. As the primary bronchus splits, it becomes secondary bronchuses. As the secondary bronchus splits, it becomes tertiary. Primary, secondary, tertiary. Now inside here is the mediastinal cavity where the heart would be. So this surface is called mediastinal surface. However, this depression where the apex of the heart would rest is called the cardiac notch. So if I ask for the depression, it's the cardiac notch. If I ask for the layer, it's the mediastinal surface. The bottom of the lung, which is flat, is the base. The top of the lung, which is pointed, is the apex. The surface of the lung is called the visceral layer. And this muscle here is the diaphragm. Okay?